We have 818 active cases. And when we look at out of the 115, 7% travel related, so that travel number is going down a little bit. It was 10% the last week or so. 94% of the cases are under 60, and then 79% of the cases are under 50. So, again, the communities from age standpoint that have been vaccinated the longest and participated at what we believe are very high rates are doing very well. The vaccine's working. Hospitals inched up today. We'll see if it stays in this range for the rest of the week. 46 individuals in the hospital, 9 in the ICU. So let's keep these 9 individuals in our thoughts and prayers and get them home, just like everybody else in the hospital. Looking at the vaccine, we're doing well. I think there's the state reported site had about 208,000 first doses have been administered. Remember, if we're using their data, 462,000 total residents, 360,000 adult residents. We're getting close to that 60% participation amongst adults. This data is always a little bit dated because it takes time to upload all of the information. So if you think about all of our distribution partners now, you have doctors' offices, you have drugstores, you have mass vaccination clinics, you have our clinics, our pop-ups. They don't all get updated the same day you're given a shot. So the reality is we're probably closer to 215,000, 220 once this all gets updated. So we're making progress. It's going to get a little bit harder to find willing participants. We're going to have to make it easier. We're going to have to go into communities. Today we were at Baldwinsville High School, and we had our first pop-up clinic at a high school. I haven't gotten the final numbers yet on how many students participated or staff. We offered it to staff as well, but I know we had at least 150 of them. So again, a good start, and we're going to do more of that. Next Monday, we have a large clinic here on the 19th. Moderna will be the vaccine. And next week, we have scheduled days at ESM High School on Tuesday and on Friday at Liverpool High School. We may plug another clinic or two in the community or in a high school there. But the idea being right now, let's get these 16, 17, 18-year-old high school students vaccinated with parental or guardian consent. So that's good. The asymptomatic testing or rapid testing, we understand things are getting a little bit busier with activities. We'll be here at the On-Center 4 days a week. We'll try to be here on Saturdays so that if you have an event that needs a test, you can get an appointment, and we'll start to print out the results so you can take that with you again, recognizing that it is a little bit more work for us, but that may be a stipulation of you going to an event. We understand that. Asymptomatic community sites. Today we were back at Onondaga Town Hall and Shove Park, and tomorrow we will be back at the Town of Clay Senior Center and Fayetteville Village Hall. I don't know. I'm sure we have some appointments still available. If you want to register, you can register on gov.net. Great opportunity to get a test, get a result quickly. And obviously anybody with symptoms, we think you should go get a PCR test. 2 other items. Our emergency rental assistance program with landlords and their tenants, the applications are going to go live on our county website on Monday. So Monday the 19th, if you are in a situation where you're a property owner and your tenant is behind, or you're a tenant and you're behind, you can go on and fill out an application, and the applications start Monday. Again, we have $26 million to invest in this problem, and we will start taking applications Monday. So please, media, help me with this. I've been getting emails from anxious landlords, so this is important. Also, in addition to that, next Thursday, April 22nd, our city branch libraries will all be open 5 days a week, 9 to 5, we will no longer need appointments in advance. So again, on Thursday, the 22nd, 9 to 5, our city branches, our downtown branch, libraries will be back open. We'll work towards weekend hours and night hours. Part of this is you have to bring back an on-board part-time employees to do this. So that's part of a process. The earliest we could even bring back some full-time employees was April 1st due to furloughs from last year, and those employees choosing to spend the duration of their furlough till the 31st. So we're working through that, but good news that Thursday, 9 to 5, all city branches will be open. Happy to take questions.
Ryan, how have the city branches been operating up till now?
So the downtown branch has been open, Tim, 5 days a week. The city branches, based off of volume, have been appointment only, but either 2 days a week or 3 days a week.
County Executive, with the Johnson & Johnson vaccine obviously being halted this week, I know that the county was quick to replace it with other vaccines that are available. Was there any evidence in people not showing up for appointments or canceling appointments because they may have been shopping for that one dose?
Not yet, but I think it's a good point that one of the nice things about the Johnson & Johnson shot is you only need one of them. And so I think we've heard anecdotally throughout the pandemic, even when we started vaccinations, that many people were waiting for the Johnson & Johnson shot just for the convenience of it. So we have not seen it yet that it's hit our numbers. It's tough now, too, because this is kind of when supply is higher than demand anyways. But the J&J shot, again, I know that you guys understand this, but they're reviewing 6 cases out of almost 7 million shots. So even though these 6 cases have serious blood clotting issues, that's a very small percentage. So hopefully this will get worked through, and the J&J shot will be deemed to be a tool we can continue to use moving forward.
And supply outstripping demand is good in a lot of ways, but is there any concern that we're beginning to hit that portion of the population that may not have interest in the vaccine? And are there any sort of plans at the moment to try to address those adults in the population that aren't willing at the moment? Yeah,
so you're right. I think within 2 weeks we'll be there as far as I think your mass vaccination clinics are going to slow down, and then they're going to get really slow. And part of that will be the points of distribution. Part of that will be because you have a segment of the population that won't get the vaccine, and then you'll have people on the fence. And so what we need to do, and we're starting to do it, we're going to start breaking down as we get through large second dose clinics still for the next week or two here. Once we're through those, and even in between, we'll be really going out into neighborhoods and into zip codes where we have that are underperforming, and we'll be micro-targeting the vaccine. Because, again, if we get to that 60 to 65% participation rate with the eligible population, really what we're looking at is how do we get another 5 to 10% to meet the standards that most of the epidemiologists suggest will get the community to herd immunity. So we're going to do it by going into neighborhoods, and then we're going to have to, as a community, have a good understanding of what the hesitancy is and how we can message coherently as a government and as public health systems to address that hesitancy, understanding there are some people that will not receive the shot no matter what we say.
Ryan, the same logic for ESM and Liverpool as Beeville. They were the next up in your survey, I assume. Yeah, very, very high participation. Liverpool was 2. ESM, even though it was a smaller district, was right up there as well. So some of this might be logistics now too, when the school districts themselves can do it as well. But yeah, we want to get to the districts that have willing participants now, and then I think in the districts that have large amounts of kids,
that aren't participating. We need to then work with that school district to get the message out that we want to vaccinate your sons and daughters, but we need your permission to do that. And that, that's something we're going to have to look into.
What kind of response have you gotten so far from the city school district?
We didn't have great first response, Tim, through that. So that we're going to have to do some work there for sure.
You sense that that's a bit of vaccine hesitancy there?
And potentially the communication channels into the household. So I think you could, I'm not sure which is, better to attribute the issue to. But certainly we did not have the same level, even close, of feedback back from parents that they wanted it done. So we got to really dive into that more. There's a lot of kids there that qualify that we want to get shots to.
Do you have what those numbers might be comparing the circumstances?
I'm not going to disclose those at this time yet. I think we got to work through this a little bit more. And again, it could, not all of these email surveys, monkey surveys, all really work as well in different districts. So we know which ones it did work well with. We'll go there. The other ones we'll need to do more work to get to the young people.
Ryan, for the rent assistance, is it the tenant who must apply?
Yeah, we prefer the tenant applies. If there's permission on behalf of the tenant for the landlord to apply, I think we could probably work with that as well. But the easiest way is for your landlords to have your tenants apply or help them apply. You can download the application, go over and help them fill it out, and then turn it in. So certainly it's a situation where the tenant's going to get some relief, not just financially, but relief with stress about their housing situation for the next 90 days. And the landlord's going to get paid money that they need to go pay their mortgage. So win-win for both parties.
So it'll be a link from the homepage to download a form?
Yeah, you'll be able to download and print one off as well, or fill it out online.
Or
Yeah,
you can fill it out online.
correct.
How far do you think the 26 million will go to meet the need?
I don't think it's going to meet it all. So I think we're going to run into challenges where maybe a third of the need, maybe a half if we're lucky.
So this will be first come, first serve?
Correct. We're going to, now what we're not going to do, Tim, is we're trying to target intentionally the smaller mom and pop landlords, your 20 units to lower, a very large property owner that can weather the storm a little bit better. Certainly we want them to wait a little bit. So we're going to try to address the issue with the smaller landlords first, and then address it for the larger landlords second.
What's that cutoff, like 20 units?
Yeah, specifically, I think that's kind of where we were. I might be off, give or take a couple units, but the idea being you have some people who own 6 or 7 properties that have 2 families or whatnot. That's their living. That's how they pay the bills for their family. And you could have 2 or 3 tenants not paying them. That's a huge hardship. So we want to address that problem first before the larger property owners who may have 10 people not paying, but may have 85 people paying, and they're able to cash flow their situation. So
But everyone should apply.
everyone should apply.
What is the county's position when it comes to potentially having a local version of the state's Excelsior Pass, or supporting what businesses may be doing in terms of only serving vaccinated people at this time?
Yeah, people, again, so we won't have a local version of an Excelsior Pass. It's just something that we would view as a duplication of effort. And so, again, I'm a huge proponent of the vaccine. I got the vaccine. My family's gotten the vaccine. My staff's gotten the vaccine. But I'm not a huge proponent of mandates. And so we will not mandate things and things we control. A private business owner may have the ability to do that. That may be their call. So private universities are mandating it for college. So if a private business owner looks at it and they think they have the legal right to do that, and it's their business, their real estate, they can probably do that.
The restaurant voucher program
Mm-hmm.
starts next week. It looks like on this website you've gotten a pretty good response for that too. What do restaurant owners and then also diners need to know about that program?
Yeah, so we'll roll out next week the dining piece of it when that goes live. We've had over 115, I think the number might be 118 restaurants apply to participate in this. So it's going to be great. We're going to have a focus on Mother's Day, and then we'll have another focus on Father's Day. And then if things go well and that $500,000 turns into over $1 million stimulus, we'll look at doing more. But next week, Trish, we'll have an event on April 20th when it goes live. We'll let you know where. You can come and see us. But it will be a good event. Everybody's very excited about it.
Speaking of businesses, we've begun to hear anecdotally that some are having trouble getting people hired, bringing new employees in for a whole host of reasons, one of them being that some people are taking unemployment at the moment. Is that something that you're also hearing from local businesses?
It is. And so just to give you in our own world, we made tough decisions in 2020 that led to employee furloughs. March 31 of 2021, we, at one point or another, to respond to the public health crisis, tried to bring back, I think, almost all the employees. We did have employees tell us they didn't want to come back. Now, why was that? It was probably because the unemployment helped offset the lost income. So as long as we have the high unemployment insurance dollars flowing, some of these industries are going to struggle. Our restaurant industry is very concerned right now because even though you may have capacity constraints loosening, if they can't get their workforce back, they then are maybe forced to hire people back that they asked to leave at one point. I've heard that. Or your other alternative is instead of being open 5 or 6 days a week, you can only staff 3 or 4 days a week. So this is going to be a challenge with the high unemployment benefits.
The governor pushing the curfew back to midnight a little too late, or?
Now, I think at this point, some of these regulations are arbitrary. Again, I asked for a curfew when we could show scientifically that bars and restaurants were driving cases. We can't really do that now. So I think some of these rules are arbitrary in nature. And again, we've asked for local control. If it was our decision now, we would not have a curfew. It would be back to 2 o'clock. Then if we received data that showed that was leading to more transmission, then we would reassess where we were. And that's normally county executives in these roles would have that decision-making power, but the state gave the governor extraordinary powers. But I don't know why. You tell me, Josh. 11:01 cutoff for COVID. Now COVID's good. They'll wait another hour. I don't know.
Usually my job to ask the question.
No, I know. It's 12:01. It's 12:01 now. So it's 12:01. So I mean, some diplomacy with COVID. It's only going to come at 12:01 now, I guess.
What is the future of the On-Center? When we got here today, there wasn't anything going on. We're talking as we get further down the road, mass vaccination clinics probably won't be as big of a thing. What is the future of this building as we fight the pandemic? Yeah, this will still be utilized for second shots coming up. So we still have a slew of mass vaccination second shots. We'll still do probably once or twice a week large clinics, whether we get large participation, that will be seen. But again, testing will be big. I think we're going to try to support the industries hit hardest by COVID with testing on Fridays and Saturdays as much as we can, understanding that we won't be able to be the answer, the end-all be-all on that. And then eventually this facility needs to do what it does best, and it needs to host events, and it needs to create economic activity for the community. So whether that's in Q3 or Q4 of this year, I'm not sure, but I hope that is. I think you'll see a lot of pent-up demand for weddings and events come back. So all of our venues will be very busy
And then once we see that all the venues are really busy in the community, we'll kind of re-engage and open this place up to the marketplace as well.
Regarding testing to support businesses, is it certain days that they'll print off your results, or every day now?
So we'll probably only do it, Tim, on Saturdays. We'll look at Fridays. Again, it's just logistically a workforce challenge for us to do that. It costs us money, believe it or not, because we need more people. So we recognize why people would come to do the rapid test, and the benefit is you get the result within the 6-hour period of time to go to the wedding or the sports game. So we did it for, we partnered with SU. We did it for both the women's lacrosse game last weekend, and I believe we're doing it this weekend. I think the lacrosse team has a big game, the men's team. I think it's North Carolina. And so we'll do that as well. And then we'll look at the Syracuse Mets and maybe some partnerships there. And then certainly we've talked to various hospitality venues as well.
Just another question on the landlord program. What kind of transparency will there be with that? Because if only a third of the eligible people are going to get benefits, how will they know how that's ranked and scored and so on? Whether they...
Yeah, we'll put all the criteria out there so everybody understands it, and any change in the process and absorb some of the problems better than the person who owns 10 units. So I'm sorry if you're mad at me about that, but that's, I deliver bad news sometimes. If it goes far enough, we'll get to you, right? And just like I got some news, right? Shuttered Venues Act, right? So the federal program has shuttered venues they gave different criteria. We have an amphitheater that lost $5-6 million worth of revenue last year. We qualify. We were told we're in the 3rd tier. So if there's still money, we might be able to get some help in the 3rd tier. So we'll look at similar programs and communicate. Again, the applications, the process starts on the 19th. We're not giving out checks on the 19th. So we'll get the applications in, understand what we have, make sure that geographically we're addressing issues throughout the county, and then I'll also really target in on where we think we can have the biggest impact as well.
Cases seem to be stabilizing sort of around 100 a day at the moment, give or take. Is it still primarily college-age students that seem to be driving it?
Yeah, so today it wasn't, you had a 15%, I think, of the good cases were higher ed driven, so a little bit lower. So right now what you're seeing a little bit, Connor, is some of your hesitant groups, 50 to 59-year-old demographic, there's hesitancy in that group, right? You're seeing cases in that group. 15% of our cases were in that demographic today. Some of the younger demographics are social demographics, and we just haven't been vaccinating there long enough to start to turn it. But to your point, last week at this time we were looking at, I think, high 140 cases on this day, and I think Friday was too. Then it tails off a little bit over the weekend. If we're in the hundreds, averaging 80 to 100, 7-day average, that's good. And if you look at where we are